Very, very warm welcome to you all. Really lovely to see so many of you coming today. Many of you have come from far afield, from Exeter, London, Manchester, Wales. Really, really pleased that many of you have come to join us for what I hope is going to be a really exciting and interesting morning. I should just introduce myself. I'm Gideon Bentovim. I chair Nature Connected, which is the local nature partnership for the Liverpool City region. And I also chair the Innovation Agency, which is the academic health science network for the Northwest Coast. And for me, this is particularly interesting morning because we're going to talk about the connections between health and well-being, the natural environment, academic research, and innovation in practice. So we've got a great range of speakers who I think are going to weave the web of how all these strands interconnect so that we can all make a great contribution to the health of our citizens in this region and across the country. So I just want to say a few words about why we're here, although I think you all know, while we're here. Our first intention was to bring together a wide range of professionals from a number of disciplines, and it's really great that we've got colleagues here with expertise and interest in the environment, people involved in health and social care, people involved in the public sector, people involved in the private sector, colleagues from academia, and it's lovely as a former academic to be in an academic setting. Nice to be here in that context. So it's really great to have a number of partners here today because it's collaborative working that I think we're going to spend a lot of time talking about. As well as bringing colleagues together, we hope today to really explore what an innovative consortium, Natural Health Service, what an innovative consortium can do by working together to use and work with and within the natural environment to improve health and well-being. And I think there's a great delivery model here, which I think could be rolled out and adopted further afield and colleagues to collaborate with around that model. And also today, what's important is we want to talk about the links that with academia and practice, how good research linked to practice can really make an important contribution to the improvement of health and well-being. So we're going to hear about a fairly robust test and health approach. Just want to say one more word really about the evolution of the Natural Health Service as an innovative delivery model. It was set up in 2012, partly in response to the growing pressures on the NHS, the growing demands, pressures on resources, and I think the growing realization of the fantastic asset that the natural environment can bring to improving health and well-being. And I think there's been that growing realization, a growing movement, and today is a part of that, which really sets out the fantastic benefits that the environment can bring as one of the key determinants of health and well-being. And I think the Natural Health Service was also set up recognizing the need for a coordinated approach, that there are numbers of initiatives, and it's great to see those here across the country grappling with the opportunities that the environment provides. But I think what's been developed here is an attempt to coordinate that effort, to bring a number of partners and players together, which should make it easier for commissioners to have a clear focus of where they can go to for evidence-based, good quality interventions that can really help make a difference. And the Natural Health Service was also very committed to making sure there really was a good, solid evidence base behind the interventions that are being developed. So the interventions are not just things that feel good and sound good, but really do have a robust basis in evidence and research to give people confidence that this is important direction of travel for the NHS. And finally, one of the important concerns of the Natural Health Service was to try to move away from projectitis, bits of work, into a more sustainable funding model to enable commissioning to take place, and for this to be part of the mainstream work of commissioning and delivery of health prevention and health improvement initiatives. So today is going to talk about that journey, some of the issues involved, some of the collaborations and partnerships that are already in place and that we very much hope will take strength after this event today. So, I'm really looking forward to this event. Thank you all again for coming, and I'm going to begin to introduce the speakers, some of whom will introduce each other, to make the welcome on behalf of Liverpool John Moores University, who've been a great academic partner to the Natural Health Service. We're really grateful for their expertise and their commitment and their work. I'd like to introduce, here he is, Professor Keith George. Keith is the Associate Dean at Liverpool JMU, and he's part of the excellent sports science team in this university, Professor of Exercise and Cardiovascular Physiology. Welcome, Keith.
Thank you very much, Gideon. It's my great pleasure to welcome all of you, those from the Natural Health Service, partners across the city, the region, country, to Liverpool John Moores University. A specific welcome to all of the guest speakers here today. And I think what today encapsulates for me is something that Liverpool John Moores sort of has in its strapline, and that is that we are a modern civic university, and we want to try and address the challenges of the 21st century facing our population. And nothing is more important for us as looking at health and well-being of the population and things that we can do to improve the health and well-being, and physical activity, natural spaces, natural environments is one of the things that we're very proud to be a part of. I'll just say a little bit about the institution. I'm sure you'll be aware that that's my sort of role. I'll do my best impression of an air hostess when I talk about the routes out of the building should there be a fire drill, and then I'll just welcome the first speaker for today. The university is 25 years old this year, so it's a big event for the university to hold in a really important year for us. In various guises, we've been around the city a lot longer than that, but as a university, this is our 25th anniversary. Fabulous news recently that we were voted University of the Year at Educate the North Awards, and part of that was about our civic engagement and the role that the university takes outside of the classroom in the local community. One of the things that we are very, very keen to do is develop interdisciplinary, multidisciplinary partnerships that take on board all aspects of external communities, whether again it's the public, private sector, the third sector, those people who are interested in working with us to engage in really important agendas. Health and well-being is something that is central to the activity of the university. I spotted Gillian in the audience, so it's very important for us to mention that we've launched a cross-faculty Institute for Health Research in the last 12 months that is bringing together partners from engineering, applied professional studies, sport and exercise sciences, education, health community, to try and address big issues with combined, coordinated thinking. And across the university, we have some real hotbeds of activity. Zoe's going to talk to you later, and Greg is going to talk to you later to represent the Research Institute for Sport and Exercise Sciences. It's their 20th anniversary this year as well, so there's another birthday celebration going on. But the world-leading work and impact agenda of that group of people is fascinating, and they'll be able to tell you about some of the stories of the development of physical activity within a sports science department. We have people working, as I said, in outdoor education, in areas related to health and urban planning in different faculties. We've got, as you'll see across the road, the new building, Sensor Cities. Sensors are going to have a massive impact upon our understanding of how active people are and where they're active. And it goes beyond human species to look at different species through drone and conservation. So it's something that the university is really seriously invested in, and we're so glad to have all of the people come to this meeting today to engage in some really meaningful conversations.